Spinal cord ependymoma, cancerous or not cancerous? Spinal cord tumor, ependymoma, is it cancerous? Definition: spinal ependymoma is a type of tumor that arises from the ependymal cells lining the central canal of the spinal cord. Classification: spinal ependymomas are typically considered benign or low-grade malignant tumors, meaning they have the potential to recur but do not typically spread to other parts of the body. Cancerous nature of spinal ependymoma. Tumor behavior. Spinal ependymomas are typically slow-growing tumors that tend to remain localized within the spinal cord without spreading to distant sites. Invasion of surrounding tissue. Although spinal ependymomas can infiltrate and invade nearby tissues within the spinal cord, they do not typically invade adjacent structures outside the spinal cord or metastasize to distant organs. Mitotic activity. Spinal ependymomas usually exhibit low mitotic activity, which is a measure of cell division and is typically lower. Diagnosis and grading. Diagnosis. Spinal ependymomas are typically diagnosed through imaging tests such as MRI or CT scan, along with a biopsy to confirm the tumor's origin and characteristics. Grading. Spinal ependymomas are graded based on their histological features, including cellular characteristics, mitotic activity, and presence of necrosis. Grade I tumors are considered benign, while Grade 2 and 3 tumors are classified as low-grade and high-grade malignant tumors, respectively. Treatment and prognosis. Treatment options. The treatment approach for spinal ependymoma depends on various factors, including the tumor's location, size, grade, and the patient's overall health. Treatment options may include surgery, radiation therapy, and chemotherapy. Safe maximal surgical excision is the treatment of choice. Prognosis. The prognosis for spinal ependymoma is generally favorable, especially for Grade I and II tumors that are completely resected. However, the prognosis for Grade 3 tumors may be less favorable due to their higher potential for recurrence and aggressive behavior. Follow-up and monitoring. Follow-up. Regular follow-up appointments with a healthcare provider are important for patients with spinal ependymoma to monitor for any signs of recurrence or complications. Monitoring. Follow-up appointments may include imaging tests, neurological examinations, and assessments of functional status to monitor the tumor's status and the patient's overall well-being. Rehabilitation. Rehabilitation and supportive care may be an important part of the treatment plan for spinal ependymoma patients, as the tumor and its treatment may affect neurological function and quality of life. Medical disclaimer. It's important to consult a qualified healthcare professional for accurate diagnosis, treatment, and management of spinal ependymoma or any other medical condition. This PowerPoint presentation provides a general overview and should not be considered as medical advice. Thank you.